Okay, so staying in the UK, we have more news, and this isn't good news. This one is United Kingdom bans puberty blockers indefinitely. It's a death sentence. So, let's get to the article. The United Kingdom Department of Health and Social Care has placed a permanent indefinite ban on puberty blockers, extending it to include Northern Ireland as well. It is set to go into effect on January 1st, 2025. And I would love to know what their rationale is. Probably something, protecting children, something. Northern Ireland was the last respite in the country for access to puberty blockers, with a previous temporary ban only including England, Scotland, and Wales. This was made in direct reaction to efforts from medical professionals to continue prescribing life-saving medical care to transgender youth in the UK. The ban does not extend to hormone replacement therapy. It only affects puberty blockers as they relate to gender dysphoria and does not affect their usage for precocious puberty or early onset puberty. The only way trans children can access puberty blockers is through clinical trials. Okay, so they obviously don't think that puberty blockers are inherently bad because there are still people who can access them. So this is obviously discrimination. Because why can't trans people access puberty blockers? This ban will be reviewed in 2027 after the results of UK-based trials on safety and effectiveness are published. Again, you obviously aren't concerned about that. You obviously know that they're safe and effective because it's used for precocious puberty. You wouldn't be using it if you didn't think it was safe and effective. So this is bullshit. This reasoning is bullshit. This has nothing to do with that. The decision is based on the Cass Review, a systemic review of the literature that has been criticized for immense bias. Dr. Hilary Cass, the researcher behind the review, had no professional history working with transgender youth and actively consulted anti-trans lawmakers in Florida during her research. Yeah, because we should totally go with someone like that. What the hell? The government is basically screaming, we want you to give us a reason to harm trans people. So let's just, make it easier for that. Researchers at Yale University gave a detailed evidence-based critique of the review, revealing that Cass had failed to bring trans people onto the project, didn't listen to the subject she interviewed, left out crucial information in her report, and relied on a highly flawed methodology which largely invalidated the claims and recommendations made. But again, that's only if people actually cared about the results, cared about facts. They just wanted the results they wanted. And because they got the results they wanted, they're going to just ignore everything else. Because if they were really concerned about puberty blockers, they wouldn't be allowed for those with precocious puberty either. But obviously that is not a problem. Trans advocacy organization Transactual provided a detailed list of critiques of the Cass Review that have been published since its findings were made public in May. The list includes testimonies from hundreds of academics who believe Cass's work is heavily flawed. Transactual Strategy Director Kane Walker denounced the ban in a statement to LGBTQ Nation. Banning medicines with no evidence of serious harm only for trans people, using powers designed for containing and life-threatening drugs, is discrimination plain and simple. To do so in order to coerce young trans people into a delayed and currently unspecified research trial, which both the BMA and Council of Europe have described as potentially a violation of the patient's rights, is an unconscionable act that will have severe ramifications for a generation of trans people. Evidence of the harm of the temporary ban continues to emerge and will grow now that it has been made permanent. Meanwhile, evidence of actual harm from the past 40 years of puberty blockers use remains elusive. That the UK government pursues such an approach while counterparts in France, Germany, Australia, and elsewhere have rejected this approach in favor of trans people's access to health care demonstrates just how out of touch with evidence the Secretary of State for Health is. When the UK is an outlier used to try to restrict people's access to health care elsewhere, then questions ought to be asked how we can be so different. Walker encouraged folks to read the organization's deep dive into the Cass review. Puberty blockers are indeed well regulated, and research has shown they are safe and have no permanent effects. They've previously been tested on youth undergoing precocious puberty and have a great deal of evidence to back their efficacy. There has been evidence to suggest that providing trans youth from access to care via the National Health Service has led to an uptick in suicides, according to activists in the region. However, the NHS disputed this claim in an independent report, which suggested that there was no statistical relationship between restrictions on care and suicides. That doesn't bode well for the NHS that they are peddling this bullshit. Because, yes, there is evidence that if trans kids can't get the health care they need, they will commit suicide. I don't know why this is so hard to imagine. That's like claiming that that cancer patients in incredible pain do not commit suicide. And that has nothing to do with their being in pain because of cancer. Nobody says that. People are aware of that. Actually, I think that the UK is trying to move towards assisted suicide. So that just makes this even more bonkers. Yet trans activist Caroline Littman, the mother of a transgender young person who took her own life after being deprived of care from NHS waitlists, revealed on Blue Sky that this report excluded her daughter, suggesting that there may be additional data that were unaccounted for in this critique. I am shaking. I am relieved. I am devastated. I am furious. I am bereft. The puberty blocker ban is a death sentence for some particularly vulnerable trans youth. It is unconscionable. When will the people with power to help sit up and listen? It's a scandal, a cover-up, a crime. I'm so sad, she said of the ban. And it's even worse because the NHS, which is supposed to be universal health care, the country's National Health Service, is backing this up. I mean, if I'm pro universal health care because nobody should go bankrupt just to get basic health care, but it's shit like this that makes you question. Because if the government were to run it, does that mean that the studies are going to be tweaked? Like the NHS saying, nothing to see here, we don't see a correlation, doop-de-doop-de-doop. No. So, yeah, That's just horrible. UK-based activist group Trans Kids Deserve Better, known for releasing thousands of crickets at a conference hosted by the anti-trans hate group LGB Alliance, launched an emergency protest outside Wes Streeting's office the day the ban was announced. Streeting is the Labor, Health and Social Care Secretary who pushed for the ban to go into effect. There are so many people, a lot of trans people who probably voted for Labor because they might be better off than with the Tory government. And then this shit happens. Are you kidding me? Wes Streeting has chosen politics over our lives, said an activist known as Grin in a statement. We are being put through an experiment, but the experiment is to deny us health care, not to provide it. He wants to see what happens to us when we grow up permanently altered in ways we never wanted, and we never consented to be a part of that. They say that he chose politics over lives, but sometimes I wonder if that isn't the point. Just because he's a member of Labor doesn't mean that this is political for him. It could easily be that he really wants trans people to just die because, the best way to deal with a group of people you don't like is for them to just suddenly disappear, as if that's how being trans works. So yeah, and it's possible that he chose politics, because my understanding is that Labor was pro-trans rights, and suddenly they did an about-face, and they stopped being pro-trans rights. So maybe there is something to that, which doesn't make him any better. Even if he doesn't actively want to kill trans people, he basically is saying, I really don't care. Which to me is no different. Whether you actively are cheering on the death of trans people or you just are apathetic, you're basically siding with those who want trans people to die. The trans-led UK news outlet What the Trans released a live thread on Blue Sky detailing the latest developments in this protest. And this is the tweet, or skeet, or whatever Blue Sky calls it. Trans Kids Deserve Better are occupying Wes Streeting's office at Ilford North. Get down there and support everyone. For folks who want to support, Signal Announcement Group. And then they give the address. We've been advised to share this. So, Wes Streeting said in a statement, children's healthcare must always be evidence-led. Citing the Cass review, he continued, we need to act with caution and care when it comes to this vulnerable group of young people and follow the expert advice. It's funny. They say it should be evidence-based, but when a bunch of scientists are saying this was a badly done study and that it's saying the exact opposite of what the evidence says, then the exact opposite of what they want you to think the evidence says, how is that saying that children's health care should be evidence-led when you are seriously choosing to believe a flawed study which is intentionally anti-trans over other scientists who are saying, no, this is wrong. That tells me you don't actually care about the evidence. That tells me you're just using the Cass review as cover, so you don't have to feel bad that you're actually sentencing trans kids to death. I mean, especially because he knows that these people are vulnerable. He knows that these people are vulnerable and potentially could take their own lives. And yet he's still claiming that puberty blockers are bad because of the Cass review. If they're so vulnerable, then why don't you listen to the critiques? That is how good science is done. You listen to the critiques. Neither the Cass review nor the politicians are doing any of that. We are working with NHS England to open new gender identity services so people can access holistic health and well-being support they need. What the hell does that mean? We are setting up a clinical trial into the use of puberty blockers next year to establish a clear evidence base for the use of this medicine. So I guess that's sort of supposed to be an under the rug. Hey, psst, psst. You can still access puberty blockers this way. So even though it looks bad, it's not as bad as you think. How about just letting them access puberty blockers? Why make this a clinical trial? I mean, you see the evidence. You can see it in people with precocious puberty. You can see the evidence there. You don't need to put evidence on trans people. It's not like this medicine just came out yesterday. Anyway, transsexuals Walker said Streeting's claim that he is doing this to help trans kids is at best paternalism. At worst, the smiling face of bigotry being passed off as concern. Yes, exactly. You're either being patronizing or you're being a bigot. But you just don't want to admit you're being a bigot. Cass said in a statement, I support the government's decision to continue restrictions on the dispensing of puberty blockers for gender dysphoria outside the NHS where these essential safeguards are not being provided. Alrighty, sure. And we have an editor's note. Of course she would support what the government decided because it was because of her report that they decided it. So, well, duh. Anyway, there is an editor's note about suicide resources, which I will again put in the description. So, editor's note, if you or someone you know is struggling or in crisis, help is available. Call or text 988 or chat at 988lifeline.org. The trans lifeline is 1-877-565-8860. Is staffed by trans people and will not contact law enforcement. The Trevor Project provides a safe, judgment-free place to talk for youth via chat, text 676-676 or phone at 1-866-488-7386. Help is available at all three resources in English and Spanish. So, with that, I will see you guys in the next video.